So now we're going to move on and focus on the results of our first pilot study that was done in 2020. In this pilot, we were focused only on the Normaling the Conversation component in the All of Me implementation framework. This pilot study measured the confidence and ability of the participants when addressing sexual health by using the 30-second message. Maggie Gannon is a fourth-year medical student at the University of Iowa. She will start her urology residency at the University of Chicago when she graduates in May. We won't have time for questions and answers, so just remember to list your questions in the chat box and we'll get back to you via email.
Welcome. Today I will be talking about implementation and evaluation of sexual healthcare training for oncology providers. My name is Margaret Gannon. I'm a fourth-year medical student at the University of Iowa Carver College of Medicine. The other author on this project, Dr. Amy Perlman, is the director of the Men's Health Program at the University of Iowa. One author on this project is a consultant for and receives grant funding from Boston Scientific. Additionally, she is a consultant for Endo Pharmaceuticals. Fortunately, patients impacted by cancer are living longer. As a result, post-treatment quality of life, including sexual health, is becoming increasingly important. This study is a part of the All of Me Iowa project, which aims to prioritize sexual health in oncology care and improve the quality of life for all those affected by cancer. The first phase of the All of Me statewide initiative involved workshops focusing on sexual health communication and normalizing the sexual health conversation in oncology clinics. Data from Phase 1 showed that 85% of oncology APPs who were tasked with providing survivorship care had no formal training in providing sexual health care. Phase 2 of the project involves implementation of sexual health care training for urology providers at the University of Iowa hospitals and clinics. The purpose of this study was to evaluate provider confidence in implementing a short introductory message regarding sexual health to urologic oncology patients before and after a sexual health training workshop. Eligible trainees were providers at the University of Iowa hospitals and clinics within the urology department. Providers who were eligible to participate in the training included medical assistants, registered nurses, and advanced practice providers. Trainees who consented to our study were directed to complete a pre-workshop survey. Then, trainees underwent a virtual or in-person workshop focused on teaching them the 30-second message, which introduces and normalizes the relationship of sexual health and cancer to patients. Participants were surveyed immediately following the workshop. The results of this study are as follows. 21 subjects, 6 RNs, 4 MAs, and 11 APPs completed the pre-training survey, and 9 completed the post-training survey. The majority of subjects agreed that providing information to patients about sexual side effects of cancer and their treatment is very or extremely important. 76% of subjects indicated they'd be able to give a short introductory message about sexual health and cancer without disrupting the flow of clinic, which improved to 89% after training. Before training, APPs indicated that they were very or extremely confident in giving an introductory message about sexual health and cancer, but only 27% of them were confident about what that information should include. After training, 100% of the APPs involved in this study were very or extremely confident in giving the 30-second message and knowing what that message should include. Before training, only 20% of the nurses and MAs included in this study indicated that they were very or extremely confident in giving a short introductory message about sexual health and cancer, and only 10% of them were confident about what the information in the message should include. After training, we did see an improvement. Half of subjects were very or extremely confident in giving the 30-second message, and 75% were confident in knowing what that message should include. Our conclusions are as follows. The All of Me sexual health care training improved provider confidence and feasibility in delivering the 30-second message about sexual health in cancer. Acceptability was high for all providers at baseline before training started, and it did not improve. This makes sense. The providers who took part in this study volunteered to be trained in learning about sexual health and cancer. So we have a selection bias for providers who are interested and think this topic is important. Feasibility of implementing the 30-second message improved by 13% after training, showing us that providers are willing to do this training and think that it's able to be done within this busy schedule of their clinics. Confidence of APPs in knowing what the 30-second message should include saw the largest improvement after training, from 27% to 100%. Baseline confidence and post-training confidence for our nurses and MAs involved in the study was lower than that of the APP group, 20% at baseline that got up to 50% post-training. Thank you for coming and listening to this talk, and we will be happy to take any questions you have.
Thank you, Maggie, for those interesting results. So far we've been hearing from a lot of presenters about treatments for patients suffering from sexual dysfunction. Up next, we'll hear from two representatives from St. Anthony's Regional Hospital in Carroll, Iowa, who helped oversee the All of Me Iowa Project pilot study, which ran from mid-September to mid-November 2020. Lori Petig is the Director of Cancer Services at St. Anthony Regional Hospital. She oversees the organizational leadership and development of the cancer service line. Jessica Borkowski is a registered nurse at St. Anthony's Regional Hospital. Since 2018, she's been the St. Anthony on-site coordinator for the All of Me program. After their presentations, we're going to be joined by Dr. Veronica Kolder, who will share the results from that study pilot. And we may have time for question and answers, so feel free to put them in the chat box.
Hello, my name is Lori Petig, and I am the Director of Cancer Services at St. Anthony Regional Hospital.
And my name is Jessica Borkowski. I am an RN and the pilot coordinator for the All of Me pilot study.
We are excited to share our journey with the All of Me program and what we have learned from this opportunity.
For a little history, our journey in becoming the pilot site for the All of Me project started when I attended an oncology conference in November 2017. Dr. Veronica Kolder presented an eye-opening presentation over addressing sexual health in patients with cancer. Dr. Kolder's speaking points resonated with me, and I felt as though this was a gap in care that needed to be filled within my organization. Knowing that my role as a healthcare professional is to advocate for every aspect of my patient's health, I reached out to Erin Sullivan Wagner for further educational opportunities. With administrative support, an on-site All of Me program was presented in 2019 to nursing staff and providers within St. Anthony. The participants within this program showed overwhelming support for the need of incorporating and addressing sexual health in the care provided to our patients who have been impacted by cancer. With continued excitement, St. Anthony was chosen to be a rural pilot site for the All of Me program that was to begin early 2020.
As all of you are aware, COVID-19 stopped many things within our personal and professional lives. Our initiatives to move forward with the pilot study came to a halt. But in July of 2020, we started thinking about how we could proceed with the All of Me pilot program, given our current conditions. Our new challenge was turning an on-site program into a successful virtual experience for all participants. The original challenge of transitioning to an online program brought many opportunities. We were now able to bring the All of Me message to more professionals within our service area.
Our first task was to rebuild our contact list. Emails were sent to those who previously had interest in the program, notifying them of our new and improved virtual opportunity. Next, we extended to other individuals and disciplines within our organization that encounter patients who have cancer.
We learned quickly to think outside the box on who would benefit from this program. Examples of this would be speech therapy, occupational therapy, and pharmacist. One of our speech therapists, Tammy, had originally declined the opportunity, but then responded. She changed her mind and stated, "I will participate because you don't know what you don't know." Upon completion of the program, she stated, "I took away way more from this than I ever could have anticipated." Another comment from Caitlin, a pharmacist. "This topic is a multidisciplinary effort. There are so many avenues of healthcare that a patient needs access to, and it takes coordination and cooperation between all providers."
Expanding the contact list included reaching out to not only healthcare providers within our organization, but outside of our organization as well. After all, the more participants, the greater impact this program would have on our organization, community, and our patients. Reaching out to other healthcare disciplines included many avenues of communication, such as email, phone calls, and direct contact. The healthcare professionals we included were pharmacists, rehabilitation services such as speech therapy, occupational therapy, and physical therapy, oncology and radiation nurses, oncology clinic support staff such as medical assistants and LPNs, providers from primary care, oncology, gynecology, and radiation oncology, social workers, mental health providers, and counselors.
Overall, we had 30 individuals commit to the program from varying disciplines. With the help of Erin and Veronica, a 9-week course with 8 modules that we could offer virtually to our group of participants was created. These weekly topics were
Normalizing the conversation, the 30-second message, normalizing the conversation, skills for challenging scenarios, evaluating the patient with sexual health problems, setting expectations, counseling the patient with sexual health problems, treatment of sexual health problems, refer as needed, and building and sustaining momentum.
Each week, it was around a 2-hour commitment, 1 hour of self-study, and 1 hour of live Q&A to talk about the topic in the module. These were very interactive and provided lots of feedback from the participants. Each discipline was able to take away something a little different from each module.
Pictured here is examples of our Roadmap for Referrals document. When creating the Roadmap for Referrals, our intentions were to have a resource that healthcare professionals could access when needing to refer a patient with sexual health problems.
Our hope is that this roadmap makes it easy for providers to identify appropriate referrals based on the patient needs. This should be considered a working document and updated as needed. We had to think about how to keep the program going within our organization. Our patient handbook is given to each new cancer patient, and sexual health topics are now included within the book. Sexual health is included in the survivorship care plans patients receive at the end of treatment. Our rehab service department is rebuilding their cancer services program. This includes additional education and a team of rehab providers coming together to support the cancer service line. As a group, we developed table tents to be distributed within the organization to help normalize the conversation about sexual health and a cancer diagnosis. We plan to take this topic and share what we have learned with our area providers and clinical staff. It takes administrative support and an on-site coordinator to make this a success. Be a champion for the program and don't be afraid to ask for forgiveness later.
When connecting with potential participants, success is embracing the face-to-face conversations. Bring them the brochure and share the importance of this topic with them.
The on-site coordinator needs to get familiar with the following: learn how to navigate Zoom and how to create an email group for communication.
The on-site coordinator will be the driving force in making this program successful within your organization. This includes someone who can regularly correspond with participants via email, telephone, and verbal communication, and someone who is willing to collaborate with other healthcare professionals and organizations. This coordinator can be anyone. Dedication is the key to making this a successful program.
In conclusion, we wanted to leave you with some of the feedback we received from our pilot study. One of the statements I really liked was from Jamie, an occupational therapist, and she stated, "I can now help patients find providers that are able to prescribe medical treatments and devices, as well as counselors who specialize in sexual health in our area that I did not previously know about."
I really enjoyed the statement from Kelly, a physical therapist. She stated, "My greatest takeaway from this program is a renewed sense of understanding regarding how patients may need to be addressed differently based on their current treatment regimen, their gender identity, and their ability to process their diagnosis and treatment at different stages in their care." The All of Me program sounds the alarm on the importance of addressing sexual health. Included in this is raising awareness to an area patients may be questioning and suffering by offering education and referrals to help them now and into their future.
So we leave you with the challenge. Create change within your own practice and organization. Advocate for your patients by recognizing that sexual health is part of all of us.
Implementing sexual health assessments into your routine is pertinent to the patient's quality of life and furthermore allows them to take control of their education and treatment.
Hi, Veronica.
Hi, I'm Veronica Colder, and here are the preliminary results from the St. Anthony's pilot study. If I could have the title slide. None of the authors have financial disclosures. Pilot objectives included the pre- and post-pilot evaluation of respondent perception of importance of sexual health care and confidence in implementing sexual health care. Next slide. Respondents were asked to complete 2 types of Qualtrics surveys, an identical pre- and post-pilot survey and weekly post-module surveys. This slide shows where you can find the pilot educational modules and lists our statistical analyses. 30 providers expressed interest in receiving project educational materials. Of these, 24 completed the pre-pilot survey and 11 completed both the pre- and post-pilot survey. Respondents who completed the pre-pilot survey fell into professional groups as shown. Doctors were invited, but none completed the pre-pilot survey. The pre-pilot evaluation of perceived importance of sexual health care showed that nearly 80% of respondents already thought that this type of care was very or extremely important. After the 9-week program, that increased to 100%. We should be one more slide forward. Evaluation of pre-pilot respondent confidence showed low confidence, with the percentages of respondents rating themselves moderately, very, or extremely confident in the listed tasks and knowledge ranging from 13 to 38%. New slide. For those respondents completing both the pre- and post-pilot surveys, provider confidence increased significantly in all areas. Next. To our knowledge, this is the largest group of rural Iowa cancer care providers ever surveyed about their perception of the importance of and confidence in providing sexual health care. Results suggest implementation of sexual health care for Iowans impacted by cancer may be entering a new phase in which providers are aware of and acknowledge the importance of such care, but may not yet have the confidence needed to act. The improvement in respondent confidence after this educational program lends support to All of Me project plans for a statewide rollout of implementation resources next year. Please let me know if you can help us with the analysis of our qualitative data not reported here. Next slide. Thank you.
Thank you, Dr. Colder. I'm so glad not only that you've been implementing these pilots, but also that you're collecting data on it so that it's something that we can publish and learn more and spread the word with that data. So we did get one question in the chat box that I actually was going to ask Erin, and it was a question about, is there an example of a script for the 30-second message available?
Great. So 30-second message script. So it has 6 components. And the reason we named it 30-second message is because it takes no longer than 30 seconds to give this message. It has 6 components: that your side effects are common and expected. That's one. that we believe they are quality of life issues. Most patients do. That's 2. We have resources to help. That's 3. And it's important that you bring your questions or concerns to us. We believe they are healthcare issues. That's 4.
5 is you may not care now. And the reason we have that as number 5 at this point is we understand that in the wake of a diagnosis, not everybody cares about their sexual health. So the number 5 is, though you may not care now, studies show that addressing sexual health issues sooner versus later can make a difference in the outcome. And that's number 6. So that whole message put together can be said in less than 30 seconds. You can find a worksheet on the All of Me site that will walk you through creating your 30-second message. And if it's not there, it'll be there next week. We're putting so much more information up in the next few days. And there's also that 3x3 card. So underneath the All of Me resources, you'll find a 3x3 cheat sheet card, really, that gives you those 6 components that I just walked through, along with setting expectations.
Thanks, Erin.